Hello, everyone. This is Erin Burho, and I'm presenting on Pick's disease, a rare form of irreversible dementia. Pick's disease, or frontotemporal dementia, is considered a subcategory of dementia and is a neurological condition characterized by a progressive deterioration of behavior, personality, language, and motor skills that occurs most often in people between their 40s to their 60s, but can develop as early as in people in their 20s or as late as their 80s. Essentially, people with Pick's disease have an abnormal substance called Pick bodies inside nerve cells in the damaged portion of the brain. Pick bodies contain an abnormal form of protein called tau. I think I'm saying that right. But this protein is found in all nerve cells. However, people with Pick's disease have an abnormal amount that doesn't naturally break down, but rather builds up in the frontal lobes, which is the area behind your forehead, or the temporal lobes, the region behind your ears, and deteriorate the otherwise healthy brain cells that exist there. This nerve cell death leads to the shrinkage of the brain tissue, resulting in dementia symptoms. On this slide, you'll see a list of symptoms that people with this disease may exhibit. Like most diseases, symptoms of Pick's disease will vary from person to person, and how far the disease has progressed will determine how many outward symptoms are exhibited. Because the symptoms of Pick's disease typically don't include memory changes until the late stages of the disease, the behaviors and emotional changes may initially just be thought of as selfishness, rudeness, or simply out of character emotional behavior from that person. Unfortunately, this leads to delayed diagnoses, and that delay is actually why our ability to understand this disease is limited, and even leads to inaccurate diagnoses. Typically, it'll be misdiagnosed as a psychiatric disorder and can lead to improper treatment. The sad part, too, is that Pick's disease typically affects people who are younger. Frontotemporal dementia, i.e. Pick's disease, does not affect people in their midlife years as much as compared to other dementias, or Alzheimer's, which is generally more prevalent in older years. Younger people with dementia, therefore, had the added struggle of interference with raising a family or working at a job, which again is largely dismissed as that person just having a lack of work ethic or abusive tendencies. Because Pick's disease inevitably gets worse over time and leads to a loss of motor skills, a person who is in the late stages and that receives the diagnosis would likely then show muscle weaknesses and decreased coordination, and even maybe issues like swallowing, chewing, moving, etc. But again, this would not be the first sign of anyone with Pick's disease. Eventually, people with this type of degeneration die because of the physical changes that can cause detrimental internal infections. We all know that making a diagnosis of a rare disease can often be challenging. The same goes for Pick's disease. Healthcare professionals are typically going to look at a person's medical history, symptoms, physical examination, and laboratory test results in order to make a general diagnosis. But the neurological exams are the core of the diagnosis because the MRI and CT scan, which will show the physical buildup of the protein. The sad reality is that there really is still no specific treatment that are effective in stopping or slowing the progression of Pick's disease. There are medications that can reduce agitation, irritability, depression, and outward symptoms, but these treatments are more designed to help improve quality of life, but don't actually change the outcome of the disease. It's still going to progress. While all types of dementia and Alzheimer's are difficult both on the individual who suffers from it and the family who has to watch their loved ones struggle, Pick's disease especially has a unique set of challenges because it is easily misdiagnosable, and as you can see from this slide, also gets lumped in with Alzheimer's, even though the two diseases are different. I think the toughest part about Pick's disease is actually that no one really knows how it starts or what it is. Until I picked this topic, I didn't really know it existed, and relatively few people are familiar with Pick's disease as compared to Alzheimer's disease. This doesn't mean that one is necessarily easier than the other, but there are more resources and education on Alzheimer's disease. So Pick's disease simply requires more education and public awareness. Another concern with Pick's disease is that memory is not the key issue like most Alzheimer's patients. In fact, memory might remain intact, but personality changes are going to be more common. So while personality and behavior changes are the most common symptoms in early Pick's disease, first reactions aren't usually to assume that this is a dementia issue, but rather a psychological issue, because the issues appear in the form of causing hurt feelings, extreme frustrations, anxiety, isolation, and broken relationships. Actually, broken relationships is probably the most sad reality of Pick's disease, because it has gone unchecked, and it appears that the loved one doesn't care about the people that are around them, and that's just not the case. Essentially, because the frontal lobe is what connects to our emotions, those affected by Pick's disease lose the ability to feel their emotions or feel the drastic extreme of their emotions. Thought it was interesting that some researchers have even found that people with Pick's disease can correctly identify whether the emotions displayed by someone else are positive or negative, but they really can't recognize their own emotions in themselves. Obviously, this can make it difficult for family and friends who will be the recipient of these misguided emotions, and it can even push them farther away. But this is all the more reason why it needs to be addressed. With these extreme emotions comes also the likelihood that a criminal or legal trouble could happen. Pick's disease has been known to manifest itself in inappropriate sexual behavior, public indecency, stealing, trespassing, and even just not paying attention to basic traffic rules. At the end of the day, I think it's important for all of us to remember that there are few resources available for Pick's disease, so identifying the symptoms early on is going to be key. Unlike more familiar diseases like Alzheimer's, there are fewer physicians who are experts in Pick's disease and less community support for those with the disease. Therefore, people like attorneys should be conscious of what to look for when clients come in our office and understand the immediate needs of diagnosis and treatment. Here are a few extra resources that helped me in this presentation, and I hope this has proven helpful to you. Thank you.